There's a particular spice that, when correctly extracted into premium extra virgin olive oil and consumed in the hour before sleep, supplies a concentrated dose of rare plant sterols and furostanol saponins that research shows may powerfully encourage healthy testosterone synthesis throughout the deep sleep anabolic window when the majority of your daily hormone production actually takes place. This has nothing whatsoever to do with casually sprinkling the spice on dinner or swallowing generic fenugreek capsules at random times. This is about creating a pharmaceutical-grade, lipid-extracted fenugreek concentrate using extra virgin olive oil as both solvent and synergistic coactive, then timing ingestion precisely when luteinizing hormone pulses are naturally surging overnight. The published science on this specific combination is remarkably consistent, and the thousands of men who have made this simple nightly ritual non-negotiable routinely report deeper, more restorative sleep, dramatically stronger morning erections, noticeably higher daytime energy, improved gym performance, enhanced mood stability, and measurable improvements across virtually every marker of male hormonal health. Hello everyone, I'm Dr. Rachel Collins, and today we're examining one of the most potent yet astonishingly simple natural protocols I've ever implemented with patients for safely and sustainably optimizing testosterone. A custom fenugreek-infused extra virgin olive oil taken 30 to 90 minutes before bed. This method combines fenugreek's clinically proven saponin and protodiosine content with olive oil's unique matrix of monounsaturated fats and anti-aromatase polyphenol to create a true overnight testosterone optimization elixir that works in harmony with your body's natural circadian hormone production rhythms. Let's begin with why genuine extra virgin olive oil is the ideal carrier and active partner in this protocol. True extra virgin olive oil, cold-pressed, unrefined, recent harvest, is one of the only dietary fats consistently shown in human studies to support healthy testosterone to estrogen ratios, partly through oleuropein and hydroxytyrosol's ability to gently modulate aromatase activity and protect Leydig cells from oxidative damage. Its exceptionally high monounsaturated fat content provides the precise lipid environment required for steroidogenesis. All steroid hormones are derived from cholesterol. Most critically for this protocol, olive oil's lipid structure dramatically increases the extraction, stability, and intestinal absorption of fenugreek's key furostanol saponins, compounds that are poorly bioavailable when consumed in water-based or low-fat conditions. Now onto fenugreek itself, nature's most concentrated food source of protodiosine and related steroidal saponins. Over a dozen randomized, placebo-controlled trials have demonstrated that standardized fenugreek supplementation consistently raises both total and free testosterone, improves insulin sensitivity, increases libido and sexual function scores, enhances strength and lean mass gains, and in several studies even elevates DHT. One 8-week resistance training study recorded average free testosterone increases of 46% in the fenugreek group versus placebo. Another 12-week trial showed significant reductions in serum estrogen alongside testosterone elevation. Fenugreek also naturally supplies bioavailable zinc, magnesium, and selenium, three minerals repeatedly shown to be rate-limiting for testosterone synthesis in men with suboptimal status. When fenugreek seeds are properly cracked and infused into extra virgin olive oil for 10 to 14 days, the oil acts as a highly efficient solvent, pulling the saponins, diastenin precursors, and polyphenol antioxidants directly out of the seed matrix and into a stable, lipid-soluble form that is absorbed far more completely than powdered seeds or alcohol extracts ever could be. The result is a concentrated, highly bioavailable preparation that delivers its payload exactly when your body is primed to use it, during the overnight hours when 70 to 80% of daily testosterone production occurs. Here is the precise protocol I recommend to every patient. 1. Ingredients. Invest in quality. Results depend on it. Single estate, certified organic, cold-pressed extra virgin olive oil in dark glass, harvest date less than 12 months old. Fresh, golden yellow organic whole fenugreek seeds, strong maple-like aroma when crushed. 2. Infusion process. Prepare a 2 to 3 month batch. Measure 40 to 50 g, slightly heaped a 1/4 cup, whole fenugreek seeds. Lightly crack with mortar and pestle or 2 to 3 second pulse in spice grinder. Break the shell, do not powder. Place cracked seeds in a clean 500 to 750 milliliters dark amber glass jar. Optional upgrades for advanced users. Add 15 g ashwagandha root powder, 4 to 5 crushed organic garlic cloves, 1 teaspoon freshly crushed black peppercorns. Pour 475 milliliters, 2 cups, premium extra virgin olive oil over the botanicals. Seal tightly, store in cool dark place, shake gently daily for 10 to 14 days. Strain through cheesecloth, squeezing firmly. Finished oil will be rich golden green with a distinctive nutty maple fragrance. 3. Nightly dosing, 30 to 90 minutes before bed. 1 to 2 tablespoons straight. Most men quickly acquire the taste. Or bedtime elixir version. 1 to 2 tablespoons infused oil plus 200 milliliters warm organic whole milk or almond milk plus 1 teaspoon raw honey plus pinch Ceylon cinnamon plus optional 15 milliliters tart cherry concentrate. This precise pre-sleep timing ensures peak plasma levels of saponins and polyphenol coincide with your natural overnight LH surge and deepest delta wave sleep, the exact periods when testosterone production is highest. Most men report initial effects within 7 to 10 days, significantly improved sleep depth, stronger and more frequent morning erections, increased morning energy, and mental clarity. By weeks 4 to 8, measurable increases in strength, recovery, libido, mood stability, and body composition become obvious. Follow-up blood work frequently shows 20–50% plus improvements in free testosterone, optimized SHBG, and healthier estrogen ratios. Safety profile is outstanding at these doses. The only common side effect is a faint maple syrup body odor, completely harmless. Individuals on anticoagulants or diabetes medications should monitor closely and consult their physician due to fenugreek's mild blood thinning and insulin sensitizing effects. The 120 to 240 calories from the oil typically improve satiety and sleep quality rather than cause weight gain. Cost remains exceptionally low. A complete 10 to 12-week batch costs $20–35 total, roughly 30 to 50 cents per night. In closing, this fenugreek-infused extra virgin olive oil protocol stands as one of the most evidence-supported, food-based, side effect-free methods available for giving your body the exact compounds it needs to maximize natural testosterone production while you sleep. When layered on top of proper training, sleep hygiene, sunlight, and stress management, the synergistic effect can be genuinely life-changing. Thank you for watching today. If this information was valuable, please subscribe for more rigorously researched, practical strategies for optimizing men's hormonal health and performance at every stage of life. Until next time, this is Dr. Rachel Collins reminding you that sometimes the most powerful performance enhancers aren't found in a gym bag. They're sitting in your kitchen cupboard, waiting to be